Quiz 2, question 2 has to do with the cortical spinal pathway, which is the descending motor pathway. The descending motor pathway provides strength to our muscles. So if you damage the cortical spinal pathway, you are going to have muscle paresis, plegia, or paralysis, depending on how much damage there is. It also will lead to spasticity. If you damage the descending motor pathway, it can no longer inhibit the stretch reflex that lives within all of us. So you get hyperreflexia, otherwise known as spasticity. So damage to the descending motor pathway will lead to spasticity and paresis or weakness. Rigidity is associated with damage to the basal ganglia. That's a form of hypertonia or muscle stiffness, and it commonly occurs in people with Parkinson's disease, which we'll talk about later this week. Chorea also occurs when you damage the basal ganglia. It's associated with Huntington's disease, and it's a lot of twisting and writhing types of movement that are involuntary, so the patient has no control over them. So again, you have to have damage to the basal ganglia to see chorea. Nystagmus occurs when you damage either the cerebellum or components of the vestibular system, not the descending motor pathway. Apraxia, if you'll recall, is where an individual has normal motor and normal sensation. They just can't respond to your command. So you may ask them to answer the phone and they don't do anything, but yet when the phone rings, they pick up the phone automatically. So in that scenario, if someone has apraxia, they actually have normal muscle strength. If they just had isolated apraxia, they would have normal muscle strength and normal sensation. Therefore, it's not damage to the motor pathway or the cortical spinal tract. It's actually damage to the left side of the brain, and more specifically the parietal cortex.